Hi, I'm Sanil Rege, consultant psychiatrist and founder of psych.com. One of the most common questions that patients often tend to ask is, what's my diagnosis? So they tend to ask whether they've got depression or bipolar disorder or anxiety, etc. But I often tell patients that it's not always easy to put people into categories because the brain's a lot more complex than that. And that's what I'm going to try to show you today, something that I often tend to explain to my patients. So let me start off by drawing the brain. Now, when we look at the brain, there are two key areas that we need to focus on. Most psychiatric disorders involve two key areas, the front part of the brain and what's called the limbic system, which is the fight and flight area. The limbic system is sort of situated in this region. I'll mark it as L. And then you've got the front part of the brain, which serves a different function. The front part of the brain is responsible for motivation, drive, attention, concentration, pleasure, mental fatigue, things like that, which is quite different from the functions that are affected when the limbic system is involved. The limbic system consists of an important part called the amygdala, and the amygdala is the threat area of the brain. The area which, when involves fear and aggression. Similarly, when the limbic system is involved, because of certain neurotransmitters going haywire, then we tend to get a different set of symptoms. The main neurotransmitters in psychiatry are serotonin, noradrenaline, and dopamine. There are others, but to keep it simple, I won't go into those. Now, what happens if there is increased dopamine here? Then the limbic system is affected and can give symptoms such as agitation, racing thoughts, insomnia, the difficulty sleeping, and an overall sense of restlessness. And that happens if there's increased dopamine. On the other hand, the front part of the brain, if there's decreased dopamine, then you tend to get a decrease in pleasure, decreased attention and concentration, decreased motivation and drive. So you can see depression can result because there's decreased dopamine in the front part of the brain. And me as a clinician, what I can do is use medication to increase dopamine here. Similarly, if I find out that the patient's having insomnia or racing thoughts or agitation or increased anxiety that may be due to increased dopamine, then I can use a certain medication such as a mood stabilizer to bring down that dopamine to address these symptoms. So this is essentially how we're thinking. Anxiety is also situated in this part of the brain. Now, what's important is the limbic system can be affected by a range of factors: stress, hormones, female hormones, male hormones. It can also be affected by any other traumatic experiences, trauma. Therefore, it's really important in the history to take account of these things as well. Additionally, we know that in the absence of medication or psychology, the only thing that can take control of the limbic system is the front part of the brain. Now, the function of the front part isn't to look after the limbic system. The limbic system should be able to self-regulate. Now, if the limbic system isn't able to self-regulate because of illness, then what you get is the front part of the brain trying to bring the limbic system under control, and as a result of which cannot work on the functions that it's meant to, and therefore over time can get very fatigued. That's why we often tend to see people when they have extreme agitation, anxiety, racing thoughts that can present with extreme exhaustion. Therefore, in some cases, if I simply prescribe an antidepressant, the antidepressant may improve the neurotransmitters in the front part of the brain. But you see, the limbic system is still overactive. Therefore, in some cases, one does require a combination type treatment. It is also difficult if there is severe agitation or the severe overactivity of the limbic system, to simply address it through psychology. Because for psychology to work, one requires a very high-functioning front part of the brain. In other words, a front part of the brain that's not fatigued. So therefore, when one thinks about how complex the brain is, it's not always possible to lump people into categories. It's sometimes helpful to deconstruct the symptoms, apply them to the respective areas of the brain, think about the neurotransmitters involved, and think about the factors that might be worsening some of these symptoms. Medical factors, psychological factors. Bring them all together in a formulation in order to provide the best treatment for the patient. It is important, however, to discuss all your symptoms with the doctor, and this is not to be construed as medical advice.